Dr. Terence.
Hi, I'm Dr. Sarah.
We're the dentist from Kingsford Dental, and everyone now know about the COVID-19 virus, right? It's so many cases in Australia now. It's nearly over 5,000 cases in Australia. Yeah. So it's quite a lot of number, and the government actually suggests us to stay at home to try to flatten the curve of
What are the measures that the Department of Health in Australia has introduced, Dr.
I
Terence?
think mainly the three things are social distancing. Mainly try to stay at home, okay, as much as you can, okay. If you don't have any urgent need, just stay at home, okay. And if you need to go outside, keep the social distance about 1.5 to 2 meter, which is about arm's length, 2 arms lengths, okay, of 2 people. And also try to wash your hands as much as you can. Like if you try to touch something, okay, try not to touch your face, your nose, your ear, and try to wash hand as much as you can. Okay. And one more thing is about controversial about mask wearing. Do you think is it necessary?
So up until yesterday, in Australia and in the United States, the government is still suggesting us not to wear any mask when we go in the public. But up until yesterday, I saw a news from the United States that they're starting to analyze the reason why China, Taiwan, and Japan can control the COVID-19 spreading a lot more effectively than what we're doing here. And what they found is everybody in these 3 countries that I've just mentioned before is wearing a mask. It doesn't have to be. If everybody is wearing something, a piece of cloth or a piece of scarf, that is enough to stop the spreading of the droplets or your saliva to be contacting the surfaces or the other person. And if everybody is doing some things, but while keeping the surgical mask and the N95 to the frontline hospital personnel, because they are dealing with people who are contracting, who have contracted COVID-19, and they needed that the most. So if we all do a little bit of something, that's going to help.
And this virus is so contagious, and death, a lot of people die because of it, right? So why is it important to flatten the curve?
Oh, right. Speaking of that, if you not know of that yet, the fact is in Australia we only have about 2,000 beds in intensive care units. So if in the unfortunate situation you contracted COVID-19, what's going to happen more than likely is you're going to have lung infection. So what it means by lung infection is that you will lose the ability to breathe for yourself, to get oxygen in your body, okay? That's really important. Without oxygen, we die. So at the moment, so far, there's no medicine that can cure COVID-19. So the only things that we can, as human, what we can do is the hospital can actually use a machine called ventilator. It will help you to breathe, to pump oxygen into your body.
To keep you safe,
and
keep you alive.
We only have 2,000 of those. If you have more than 5,000 cases and it's still growing, we're gonna have problems where some people might die because they cannot get hold of the ventilator.
So that's why I think as a member of community, we need to help, okay, to flatten the curve, okay. So by providing the social distancing and also, so that's why we follow the government restriction, because that also help to reduce the number of the
Exactly.
cases.
So what we're doing in our practice is we are actually practicing under level 3 restriction. So what that essentially means is that we are only here because we are trying to see or help our community to see patients who have got toothache, gum infection, or trauma. So those 3 issues, it can be life-threatening if it's not treated. And if we're not here to see these patients or see you, these cases will then go to the hospital, which is already overwhelmed at the moment. It's not safe for you, and it's not it's overwhelming for the hospital setting.
Since we committed to serve our community and help to control the pandemic, okay. So, but a few measures we need to adopt it recently in our surgery to prevent the spread of the disease. Okay, that's which is included the mouthwash. Okay, we will need you to. But anyway, okay, before you started, okay, we may need to have a screening survey. Is it right? Like, what's that?
That's a very. It's a long survey, but it helps to make sure that we determine the risk of any patient being a COVID-19 silent carrier or active carrier.
So yeah, so if you after you screen it, okay, so and if you really need to be seen in person in our surgery, so we will need to use mouthwash, as I said. Okay, there's a special mouthwash you can use, okay, for 30 seconds, okay, and then we will have the protective barrier, okay, which is we always have, okay, but yeah, we have extra precaution in place. Okay, we'll increase the frequency of wiping the door handle, the surface. Okay, but one new things to our surgery is about the teleconferencing. Okay, to do an online consultation with the patient.
Yeah.
What's that all about?
Basically, what we're doing is if you or your family or your friends who needs some dental diagnosis or dental consultation because you've experienced one of these three emergency, but you're not feeling comfortable to actually come out to the public, you can actually just contact us and we can provide a teleconferencing to help to work with you to find out what's actually wrong with your teeth. And sometimes toothaches, little toothaches can be solved by just home measures or medicine, and sometimes you do need to come in, okay, but by doing that sort of screening, at least it reduces maybe half of the people that needs to come out to the public and expose themselves to
the unnecessary risks. So in the meanwhile, I think even we can't see you every 6 months for checkup and clean, we still recommend excellent oral hygiene. Why is that important? Is it,
it's super important. Our mouth is actually part of our immune system in our body. So if you have severe gum disease or you have lots and lots of decay cavity in your mouth, what it means is that your mouth is full of bacteria and viruses, and that triggers lots of immune system, and that puts you at a higher risk of the category to catch COVID-19 because of your low immune system.
That's exactly right. Okay, so as usual, we always recommend people to floss once a day at least. Okay, twice a day. Brush 2 times. Okay, if you can do 3 times a day, it's okay. After meal. Okay. Yeah. Other than that, okay, with
So at the moment, we would like to really express our gratitude to your understanding and your support, and we did had to change quite a few appointments around because of this COVID-19 pandemic and the application of the restriction to comply with the government recommendation.
Yes.
This is basically to protect our community.
So yeah, but this pandemic will be over.
If we do, I believe that too, Dr. Terence. If we all do our part and maintain our personal hygiene and maintain the social distancing and stay at home for a little bit, we are all going through that together. This is, the whole world is going through this together with us, and we will go through this together.
Yes. Yeah. But stay safe, okay, everyone. Okay, so and we'll see you next time on talking about discuss different topics.
Okay.
Thank you.
Thank you. Bye.